The House of Representatives has pledged its support to improving the infrastructure and medical services of hospitals across the country. This, it says, is with the intent to eliminate medical tourism. National Assembly correspondent Joke Hadisa reports.
In Nigeria, many rural areas lack functional and effective healthcare centers. Even where these facilities exist, they are at best referred to as mere consulting clinics. This is due largely to the absence of requisite drugs and other medical equipment to make them meet the health needs of the people. The already bad situation is made worse by the outbreak of COVID-19, and health workers have been overstretched. This development, made possible by dwindling budgetary allocation to the health sector, has compelled many medical personnel to find greener pastures outside the country. At this oversight, members of the House Committee on Health Institutions are on assessment visit to the University of Abuja Teaching Hospital. They are taken on a guided tour to the cardiology and ophthalmology units of the trauma center. The visiting team is happy with what it has seen and promises to further assist in getting adequate support for the hospital to meet international standards.
When we visited the institutions last year for oversight activities, we made recommendations to the federal government. So as soon as the government starts implementing those recommendations of ours, medical tourism will be a thing of the past.
For their host, the hospital remains very effective in managing COVID-19 cases and can only do better with improved funding.
It is nice that they have come to see, and it is nice that we have also shared with them some of the challenges. It's work in progress, and I suspect if we have another opportunity to meet them, i.e. with respect to appropriation for the subsequent years, when we make requests, it will no longer be new to them. I'm sure they'll be very supportive.
The outbreak of the deadly coronavirus has put a spotlight on the nation's healthcare system. Persistent calls on the authorities to devote more funds to the sector have grown in recent times. All eyes are now on the government for the revitalization of the sector in the face of such pandemics as Ebola and COVID-19. Joke Hadisa, TVC News, Abuja.